Family Clinic at Valley Cities, located in Lakewood, Washington. And facilitating this presentation with me today is one of our therapists who specializes in trauma, Jennifer Fama. And she is going to start off the presentation talking a little bit about what trauma looks like. And then we're going to move into discussing trauma in the brain, the impact of a pandemic and COVID-19 on mental health, and then close it up with what can we do about trauma, what can we do specifically as a clinic to support, and also provide you with an exercise that you can take with you for yourself, for your family, for people that you work with, and go from there. So without further ado, I'm going to turn it over to Jen to start off our presentation. Thank you, everybody.
All right, thank you, Nichole. Can everyone hear me okay? Nichole can be the judge of that too. Thank you. All right, so let's get started with some true or false. So we are going to use the chat function. And I'm just gonna run through some statements that might support or dismiss some misconceptions of trauma that are pretty common. So let's go for our first one. So there's a limited range of situations and events that can be considered traumatic. Do you believe that's true or false?
Just throw your answer in the chat. False.
Okay. All right, so yeah, that is false. There are no specific boundaries limiting what situations can be defined as traumatic experience. What's traumatic to myself might not be traumatic for you. Someone might experience trauma from being teased or bullying growing up, while others might experience trauma from things like terminal illness, natural disaster. So it doesn't have to be an obvious trauma in order to be identified as traumatic. So the second statement, you must directly be affected by a situation or be on the front lines of a potentially traumatic event in order to experience the trauma. Is that true or false?
Lots of falses.
Lots of falses, okay. Yeah, so that is false. So some people experience trauma just by witnessing an event, not even necessarily being directly involved. In some cases, people experience trauma symptoms just by hearing about a highly distressing or hurtful event, or by witnessing a loved one struggling through their own trauma recovery. Next statement, you must be able to remember exactly what happened in order to experience trauma. Or in order for an experience to be considered trauma.
More falses.
Okay, so that one's also false. So forgetting part of a traumatic event is very common. The brain is our ultimate protector from harm, so if an event is distressing enough or disturbing enough, your brain can go offline. And that sends you into autopilot mode, where you might be physically present and here, but the situation is not fully registering in your mind. And that leads to the gaps in memories, manipulated memories. And then there's also abuse and neglect that can happen in toddlers or infants that's so early in brain development that they don't understand what's happening. And this can have a traumatic event or a traumatic effect for years, even if the individual doesn't consciously remember. And in my experience in therapy, if these memories do end up revealing themselves, a lot of times it's likely to happen when processing a completely separate trauma. Next statement, resilience is someone's ability to ignore, repress, and hide from stress or adversity.
We had a quick false on that one.
All right, so yeah, that one is false. So resilience is about the bounce back. It's the ability to adapt to endure, to cope with stress. With time, with patience, with practice and therapy tools, we can develop and increase our resilience. If left untreated or neglected for too long, symptoms could become more permanent. But the longer the delay in trauma treatment, the more likely it is that a person's going to find themselves in additional traumatic situations. So that includes unhealthy relationships, negative behavioral cycles, substance abuse. And last, and sometimes more controversial, depending on who you talk to, Once diagnosed with PTSD, an individual will have it for the rest of their lives. Oh, people are hesitant on this one.
Yeah. We have it true.
Okay. So this one we're going to say is false. So PTSD does not have to be a forever diagnosis. You can resolve a trauma, and if you do resolve a trauma, it might still sting or hurt when you think about it, but it won't be debilitating and it won't impair your functioning day to day. And if it does not have that level of impairment, then it wouldn't meet criteria for a diagnosis of PTSD.
And I think an important thing to remember is that PTSD is a diagnosis tool, generally for professionals. And so while we say that PTSD can be resolved, obviously we are not magicians. We can't remove the event from somebody's memory or take away the impact or the meaning it had on somebody's life. But we can help that event transition from something that feels like an open wound that we're constantly reacting to something that's more like a scar, right? You remember how a scar happened generally. You can look at it and it may hurt when you remember how it happened, but a scar doesn't hurt like an open wound is. And that's what we mean when we talk about that PTSD isn't forever diagnosis.
Awesome, thank you. All right, so let's look at defining trauma. So trauma is a response to a deeply distressing or disturbing event. And this event overwhelms the individual's ability to cope. So it causes feelings of helplessness, it can lead to hopelessness, it can diminish the sense of self, and it lessens the ability to feel a full range of emotions and experiences. So a pretty common symptom that people come to us with is the feeling of numbness that they might not directly attribute to trauma. But there are often clients that feel like, hey, I have all of these great things going on in my life. Why don't I feel happy? Why can't I fully enjoy them? And that's a pretty good indicator that there is some unresolved trauma. So let's look at what traumatic stress is. So it's likely that we've all experienced something traumatic. It's how we responded to the event that determines the severity of impact on us. So to put it into context, I'm going to use the example of 9/11 and the theory of 9/11 and proximity. So those directly impacted those who watched it happen on TV, those who heard about it afterwards, and then those who experienced Islamophobia as a result. It proves that even with varying degrees of separation from an actual event, trauma symptoms can still develop. There's attachment trauma, and attachment trauma refers to child abuse, abandonment, neglect. When the person who's supposed to love and care for you is the person that also hurts you, it makes sense that maybe you can grow up to fear both intimacy and being alone. It leads to not being able to form healthy interpersonal relationships and can prevent that individual from reaching key developmental milestones as a kid, as an adolescent, or as a young adult. So most therapists and most people in general will have an understanding that maybe when a woman who survived a sexual assault might see all men as a threat, might label all men as dangerous. But what's often missed and neglected to explore is how entire communities and cultures of people can respond to a traumatic event as a result of systemic racism, injustice, oppression, and prejudice. We're going to dive a little further into that. And we're going to talk about historical trauma. So historical trauma is multi-generational and related to events that oppress a particular cultural, racial, or ethnic group because of their status as oppressed. This includes slavery, the Holocaust, forced migration, and violent colonization of Native Americans. So for members of any of these communities and more communities, daily reminders of racial discrimination can amplify the individual's responses to trauma. To highlight some multi-generational effects, we can look at the Holocaust. So this was an attempt to erase millions of people who identify as an oppressed cultural identity. After their liberation of Nazi camps, survivors found themselves displaced for years. They feared returning home. Seeking refuge in other countries was often dangerous. Some people felt it was the safest to abandon their Jewish identity. And then anti-Semitism is still alive today. So in the past decade alone, there's been over 60,000 anti-Semitic acts or hate crimes recorded. So that's something that carries down from that event that was so long ago.
And
if we look,
go ahead. Often what we see with historical trauma too is that lessons are learned from these events that are passed down generation after generation after generation. And eventually it becomes so removed from the original event that people will look at it and not realize that it's connected. We see this, you know, as Jen's talking about in Jewish communities and Black communities in America, where we see fear and traumatic responses and behaviors that people often feel like they don't understand where this is coming from, either themselves or the larger community. Is like, why are you acting this way? But if we look, we can connect this back to the repeated enslavement and oppression of these populations over generation and generation and generation. And so these behaviors to adapt to this oppression get passed down into community over and over and over again until that cycle is broken.
Yes. So if we look at the most current social justice revolution going on right now, are Black Americans still fighting for equality, still fighting for equal justice. So as providers, as people, we need to recognize, validate, and honor the experiences of oppression and what has occurred over the past century and is still occurring today. As a white therapist or a white person in general, I need to acknowledge how different a Black person's experience in everyday situations is going to be. For example, getting pulled over. Now, getting pulled over in general causes anxiety for most people. But do I personally fear potentially being beaten, being arrested, possibly killed at a routine traffic stop? I don't. I can't say that I do fear that, and that's privilege. So mental health professionals need to realize that building trust is crucial and can be more difficult when working with these oppressed populations. Trauma-related events have occurred in the context of businesses, in medical settings, and government aid. So be mindful of the potential lack of trust and apprehension that individuals have when seeking government-funded services, aid, medical care, or mental health care. We're going to look at varying degrees of trauma, and we're going to start with what I call big T trauma. So big T trauma, major events that are typically seen as traumatic. So when I talk to clients about big T trauma, this is going to be known as the obvious trauma, the in-your-face trauma, the trauma that people are going to find out that you went through, and if they do, they have the sympathy and they have the validation for the experience. So this big T trauma, some events that fall into that are going to be serious accidents, near-death experiences, war, combat, natural disasters, chronic child abuse or neglect, sexual or physical assault, major surgeries, life-threatening illnesses. Now, if we look at what's called small T trauma, or referred to as small T trauma, it's seen as overwhelming, but not often acknowledged as traumatic. So small T trauma, it's important for me to point out that small does not imply small in impact, but instead it means that it's often minimized by ourselves, the person who experienced the trauma, and also others that are looking in from the outside. Unfortunately, I like to refer to this one for clients as the almost too common to be considered a trauma. So these include emotional abuse, separation and losses, failure experiences, phobia-related experiences, bullying, rejection, ridicule, and chronically misattuned care. Okay, so digging a little deeper into small T trauma. Small T traumas are not inherently life-threatening, but ego-threatening. So ego-threatening means it's a threat to a person's self-esteem and their self-image. So this is what leads to the feelings of helplessness, of hopelessness. It impacts the perception of how a person fits into the world and how they think others perceive them. And then identifying the small T experience as traumatic aids the person in recovery. So there's a saying that if you name it, if you call it out, if you identify it, it loses power. And taking back your power is a really common concept in trauma therapy, and it's used for encouraging and supporting the individual to reclaim control of their circumstance. Small T trauma is often over-rationalized and minimized. So over-rationalization examples, I just chose a few that I've heard in my time doing trauma processing. So that would be things like, it's no big deal, it's not as bad as this, well, this could have happened. Specific examples, he was really stressed at work and had to take it out somewhere. My parents were really busy with my other siblings who had way more problems than I did. so I didn't need attention. That's life. Shit happens. She only drinks that when she's only like that when she drinks. So it's not her calling me names, it's the alcohol. And then the most common is, it was so long ago anyway. Accumulating effects of small t traumas compound and create big T symptoms. So multiple small t traumas in a limited amount of time often lead to the same psychological effects as the bigger T traumas. And then an individual who withstands a big T trauma may be so psychologically impacted, a small T trauma can finally cause coping abilities to collapse. So we see this a lot when people come into the clinic. So there could be some type of situation, life stressor that ends up being the final straw that makes the person realize that their trauma symptoms need to be worked on. So that could be never having flashbacks before regarding a sexual assault until running into your abuser, or not thinking that you need to work on military related trauma until your wife says that she's going to separate from you if you don't get your emotions under control or your aggression under control.
These small T's traumas are also often when people come in and they're like, I don't know why that bothers me so much. I experienced all of these things. I survived all of these other, what we would consider big T trauma. Why is it this one thing is that what broken? And it's the cumulative effect of all of the traumatic experience. And then this one that seems so small is the breaking point.
Yep. Mm-hmm. So culture is everything. Small T trauma can be very culturally defined. Your culture defines how you experience an event, how it's interpreted, and it also defines the person's comfortability in seeking help and who they seek help from. So there are certain norms for how symptoms are expressed according to culture. So there's a vast difference in what's socially acceptable, ways to express emotions or distress among different cultures. Certain genders in certain cultures are taught to not express certain emotions, to conceal how they're feeling. In our own American culture, we still see a lot of toxic masculinity when males are judged for being ridiculed or are judged and ridiculed for showing emotion or for crying. Let's see. So cultural influences the types of services that they seek out, which means they might want to seek out a community clinic or a faith-based clinic, cultural specific services, something within their cultural community. And we also see often that clients request therapists of certain backgrounds, gender, race, or ethnicity, and religious affiliation. Okay. So this is just some of what we notice among our clientele. So I asked clinicians in our clinic what they are noticing among veterans that come in with trauma-related disorders, and then also how that impacts our military family member clients. So, pre-trauma factors in history of mental health struggles. So life events underlying mental health issues, childhood and adolescent relationships, and earlier life traumas contribute to the development of PTSD symptoms. Lack of post-deployment support, life stressors, and limited resources also lead to that increased chance of developing PTSD. Research finds that those who were unemployed after military service were more likely to experience post-combat PTSD symptoms. Loss of resources, including job insecurity, impacts self-esteem and the veteran's ability to care for themselves and their families. So this takes away from the veteran's sense of purpose in their post-military lives. Combat-related injuries and chronic pain, that's likely to reduce quality of life in military personnel and veterans, and that leads to development of PTSD symptoms. And then processing small T trauma or early life events. So starting with the earlier life events deepens processing and helps make meaning of how the big T trauma was experienced. So if small T trauma is processed in conjunction with the big T trauma, there's longer lasting, if not full relief. If we look at our family members, post-deployment adjustment and post-discharge adjustment, lower levels of self-disclosure, lack of intimacy, emotional neglect, avoidance, all have detrimental psychological effects on family members. And this is all considered or can be considered small T trauma. There's excess burden, taking on responsibilities in the household, seeing their partner suffer. This all commonly leads to higher levels of depression in spouses. We also see secondary trauma. Secondary trauma can also be referred to as vicarious trauma. So that's when service members unknowingly share their pain with family members. It can lead to emotional, social, behavioral, and physical problems for family members. And if not addressed, it can lead to a breakdown in the family system. Within kids and teens, which we see a lot of at our clinic, we see more attention-seeking behaviors, emotional outbursts, aggression, self-isolation, and poor school performance when they're impacted. Okay, so we're just going to pause and we are going to open up the room for questions before we get to our next section. Any questions in our chat box?
Chat box, or Chris can unmute you all if anybody has any questions about anything that we've covered so far about what does it mean to experience trauma, cultural specific relations to trauma, anything that you may have. You can type it in the chat or you can speak. Yep, you're able to unmute yourself if you wish.
Okay, looks like everybody is
good to go.
We have one question.
Good.
Do small T's affect how you treat the client? I would say that small T trauma definitely impacts how you treat the client. So depending on the small T trauma at hand, if it's earlier in life, if it's the current situation that's leading to them wanting to come in for the processing, everything has to be conceptualized into the client as a whole. We're looking at the bigger picture and starting with the things that are impacting them the most now, and then going back to how that relates to past traumatic events usually helps get a well-rounded treatment plan.
Yeah, we also know that depending on what happened, when the first traumatic experience happened versus big T or small t, whichever one it was, that event tends to then shape your later experience, right? So it gives you a lens that you look at the world through, which then can color what it means for these different traumas. And so we find that a lot of times if we address kind of the primary traumatic experience or the earliest or the worst one that the person experienced, that some of the other traumatic events, things that are like small T traumas, will kind of automatically on their own resolve themselves because the person has a new lens that they're looking at the world through. And so then those traumas, smaller T traumas that they experience give a different set of meaning. Oftentimes if someone has just experienced something that is small T, and we say just because those can be hugely life impacting, they don't always end up with a diagnosis of PTSD. A lot of times those individuals will have diagnoses of anxiety or depression. A lot of times we'll see bipolar disorder misdiagnosed when we know this was really a traumatic experience. And so we're really kind of using those to inform how do we approach the person in the situation, and how do we resolve some of those messages and beliefs that were learned oftentimes through this small T trauma about ourselves and the world. And Jen will talk a little bit later about, being trauma-informed versus trauma-specific treatment. And I think, that's one of the big things to take away is that we can all be trauma-informed and under the assumption that, we've all experienced something traumatic that has changed how we view the world. Thank you. If you guys have any other questions that pop up, please feel free to send them. We're going to shift gears a little bit and talk about how trauma changes the brain. I think this is really important, both, as therapists, we talk about this with the people that we serve, but also just an understanding that oftentimes what we experience with PTSD is a very normal response to an abnormal situation. Like if we experience a traumatic event, we have a very normal biological response to that traumatic event. We have our fight or flight response so that we survive. Unlike other mental health conditions like schizophrenia, we're having a more abnormal response to a typical situation, right? Typically, we don't experience hallucinations, and schizophrenia can often have the positive symptom of having hallucinations. And so PTSD is very different in that we are built to get engaged in a fight or flight response. And where the problem comes is when that response doesn't stop, when it becomes overly sensitive. So you can use your chat function. We're gonna run through a little bit of an example. So do zebras get ulcers? Anybody have a guess?
I love this question.
So do zebras get ulcers? Any brave takers? This seems like it'd be pretty stressful, right? You can see it. What's the odds that zebra's getting eaten today? Looks like it could be pretty high. But we know, you would think that, you know, this intense stress of being chased across the savannah by a lion would create enough stress to have an ulcer. As human beings, we know that, you know, stress can cause these symptoms. And Nikki put in the chat, no animals shake off trauma unlike humans. That is exactly right. So it turns out zebras don't get ulcers. And here's why. After the zebra's finished being chased by the lion, if it survives, it goes about its life, right? It goes and eats, it takes care of their young, it does whatever zebras do in the wild. If there's no lion, there's no stress. They live in the here and now, so after the lion's gone, their midbrains, which we'll talk about that part of your brain, is no longer preparing their body for survival. It's saying things are fine, and the next time they see a lion, they'll respond accordingly. Humans, on the other hand, worry about the lion that chased them yesterday. They fantasize about the lion that'll chase them tomorrow. In fact, many people get so conditioned they go searching for the lions and worry and feel like they're in danger. That worry and feeling like they're in danger is what tends to then eventually feel normal. And I don't know how to function if I don't feel this level of anxiety and fear. So there's never a time that this person's midbrain is not telling them they're in danger. And this physical reaction of constantly being and feeling like you're in danger results in symptoms like ulcers. And we'll talk about chronic stress here in a few slides, but this is your body's ability to prepare for survival, right? If we look and see a threat, if we're startled, if somebody walks in my office right now and I jump, my body's gonna prepare really quickly for survival. And as soon as I see it's one of my colleagues, my body will stop and turn that off and say, oh, it's just Jen. And she's not a threat and we'll be fine. When people experience things like trauma and repeated trauma and PTSD, their body is continually prepping for survival, preparing to fight, flight, or flee. So this is your brain and the kind of the important systems that are related to this. So you have your amygdala, which is in your midbrain. It's a very primitive animalistic part of your brain. Your midbrain and the back of your brain here where you see the hippocampus, back behind the hippocampus is the part that keeps you alive without a second thought, right? You don't have to think about breathing. Your body does it naturally. Your brain tells your lungs to inflate and you do it. Your amygdala is part of that system that is just natural, primitive part of your brain. It's your fire alarm. So this fear response makes your alarm go off with enough time to prepare your body for survival, to keep you safe. If you're out walking around, where I live, there's currently bears walking around apparently in our neighborhood. If you see a bear, your alarm goes off and it keeps you from going and giving it a hug, right? It tells you this is dangerous, walk away. So that's your amygdala. It's there to keep you safe. So individuals with PTSD tend to have an overactive fear response. So something as harmless as a car backfiring could instantly trigger panic because it's stimulating the pathway that's related to the trauma memory. It also is the part that tends to be always on alert and responsive. So your threshold for what may have triggered your amygdala prior to trauma is now a lot lower after you've experienced trauma. And the more traumatic experience we're having that are kind of confirming this sense that we're always in danger, the lower the threshold is going to be. Then we also have your prefrontal cortex. And your prefrontal cortex is that front part of your brain, but your cortex in general is that squiggly part of the brain that you see. It's what actually sets us apart from zebras and gives us all of the amazing things we have as humans, logic, judgment, reason, emotion. But it's also what sets us up for things like chronic stress, worry, anxiety. So your prefrontal cortex helps regulate the emotion responses when your amygdala is triggered. So it's the part of your brain that if Jen walks in my office and startles me, it processes the information without a thought and says, oh, it's Jen. Jen's not here to hurt me, and I can go back to normal. In a trauma survivor and those with PTSD, the prefrontal cortex doesn't always do its job when needed. This is because when you set off your fight or flight response, we have a stress hormone that we'll talk about on the next slide called cortisol that essentially impairs your prefrontal cortex. And in a fight or flight situation, you want this, right? You don't want to have to think through everything you have to do to survive. You want to just go on autopilot and do the things you need to do to survive. If we start overthinking, then we stop surviving, right? But when it's chronically activated, when we constantly have cortisol being dumped into our brain, then it takes off our ability to be intentional and to be thoughtful and to use all that higher functioning in our brain that's useful. And so our ability to rationalize, use judgment is often overridden by the prefrontal cortex, and we have a hard time managing emotions. The last piece of the brain that we'll talk about is the hippocampus, which is your system recall. So after trauma, your hippocampus is what deals with your memory. And so it's what is a part of the system that's making sense of what happened to you. And because a trauma is typically so overwhelming that parts of your brain are going offline, and we talked about cortisol, so you're not thinking clearly. Oftentimes people don't have access to the language parts of their brain, which is also in your neocortex. The information doesn't get coded correctly. So this can lead to trouble remembering important details. It could lead to remembering the event out of order or having big gaps in the event. You might find yourself thinking about what happened a lot because your hippocampus is trying to make sense of what happened. This is often why we see people having nightmares and flashbacks, is your brain doesn't like having things unresolved. It's like having a sliver in your brain, or if you have a sliver in your hand, it's super annoying. You know it's there and you pick at it and you pick at it and you pick at it until it's gone. This is the same thing with traumatic memories in your brain. Your brain will continually try to process it so that it can make sense and move on. And when it can't do that, we have things like flashbacks where we're trying to process it. We have things like nightmares where our brain is continually trying to make sense of this information. So to kind of make sense of this, I always use an example of a suitcase. If you wake up 5 minutes before you have to leave for a flight and you hadn't packed the night before, you may throw everything in your suitcase that you need for this flight, right? You'll throw some clothes, you'll throw your toothbrush, your toothpaste, your shoes. You may remember parts of what you threw in your suitcase, but when you get on your flight and you get to your destination, you may not remember everything you flew in and you put in your suitcase until you open it up again. And that's often traumatic memories that a lot of times people will have different emotions and feelings and sights and sounds that they remember are part of that event. But because all of that event was coded without a whole lot of awareness, they might not remember everything. And this is why a scent may trigger somebody's panic response, activate the fight or flight response without them even realizing it, because it's packed in that suitcase of that traumatic memory and they didn't even realize it. So oftentimes you can talk to survivors about what's triggering you. And sometimes people are like, I don't know. I really don't know. And it's because all that information was packed really, really quickly under high duress, and we don't always know what's all there. So your brain is equipped with an alarm system that would normally help alert you to life-threatening situations, right? We want this to survive. We feel this sense if you go to jump out of an airplane and skydive, right? You'll get that anxiety because we're not meant to just fly out of airplanes like that. And so with PTSD and with trauma, the system becomes overly sensitive and triggers very, very easy. So the threshold becomes a lot lower. In turn, parts of your brain that are responsible for thinking and memory stop functioning properly. They start adapting in different ways and also become really sensitive or overwhelmed with cortisol. When this occurs, it gets really hard to separate the safe things that are happening around you from the dangerous events that happened in the past. And so what we often see with people who experience trauma is that danger comes into the present, right? The danger of the past event feels like it's happening now. And so now I don't feel safe anymore. So this combination of an overactive amygdala, overactive fear system, and an underactive prefrontal cortex, right, the logic human part of your brain, creates a situation where we are always hitting the gas, right? We're always on alert, we're always on the gas, and we realize we don't have the brakes to stop it. So this might help you understand why somebody with PTSD has symptoms like feeling anxious around anything that seems like it's related to trauma. They may have strong physical reactions to situations that wouldn't normally provoke fear. So somebody may feel anxious in a situation that is not really directly connected to the traumatic event. And people tend to avoid situations that might trigger those intense emotions and reactions. Why? Because the last time that person experienced that trauma, their life was literally on the line for the most part, or they felt like it was on the line. And so we are invested in our survival and doing everything we can to not feel like that again. But I can tell you from experience providing trauma therapy and from the research that avoidance is the one thing that will maintain PTSD symptoms. We do not resolve trauma through avoidance, unfortunately, right? My hope would be never to make somebody face that again. But we don't process trauma through avoidance. In fact, what we do know is that relaxation in the face of exposure helps access the parts of your brain, language, meaning, and turning down your anxiety that help you process that traumatic event. And so there's an underlining core theme you'll see in trauma therapies that do just that. This is also why there's not always words, is that the language parts of your brain are offline experiencing trauma. So people may not always have the words they need to talk about what they need to do. So I mentioned cortisol a lot. Cortisol is essentially your stress hormone. And in these small amounts, this is a fantastic thing to have, right? If we're in a life and death situation, we don't want to overthink of it. So cortisol shuts down the processes in your neocortex, so that part of your brain that gives you logic, judgment, language, which means you lose the ability to think clearly, manage your emotions, and express yourself. If you've ever seen somebody with road rage, they're like spluttering and cussing and not making a whole lot of sense. And that's because their brain is flooded with cortisol and they're really just engaging in knee-jerk responses. It's really hard to be intentional if we are flooded with cortisol. And we see exceptions to that to people who have been trained to the point of using muscle memory. So things like military service members and first responders train themselves to be able to do their job under high stress, so that when their brains are flooded with cortisol, that their knee-jerk responses or their muscle memory response is to do their job versus fight, flight, or flee. We actually know that for those populations, if you're unable to do what you're trained to do, those are the individuals who tend to end up with PTSD. So what happens in the body when you're flooded with cortisol? Your digestive system is shut down. Why? Because it's not needed for survival, right? You don't need to worry about your bowel and bladder movement if you're trying to run for your life. Your immune system is suppressed. Again, it's a body system that is not important to survival in that moment, so it'll shut down. Your heart rate and blood pressure increases so that you can get more blood and oxygen to your extremities, not your extremities, but your interbody, your lungs, organs, all of the things that are important. Your blood is moved from your extremities into your major muscles, because your major muscles are needed for survival. You don't necessarily need your fingers as much as you need your heart and your lungs, right? And sugar and cholesterol is released into the blood for energy. So if this happens to you repeatedly, what does that sound like? Your digestive system being compromised. So this is what we see with chronic stress. Stress is a survival response being repeatedly activated over and over and over and over and over again. We can argue this happens with people in first responder positions. We can see that this happens with people experiencing systemic oppression and racism. We see this people who are just in generally chronically stressed given their life situations, whether it is struggling to make ends meet, struggling to get by. But chronic stress is that survival response being activated over and over and over again. We see this with trauma survivors. So because your digestive system is getting shut down repeatedly, we see digestive issues like ulcers, IBS, constipation. If you're constantly turning on and off your immune system, you're more susceptible to infectious disease, cold, flu, or things like our current pandemic, which we'll talk about next. We'll see high blood pressure and high cholesterol because, again, your blood pressure is increasing so you survive. Your cholesterol is getting dumped into your bloodstream so that you can use it for energy. And we also have evidence to link to diabetes and cancer. So chronic stress, repeated trauma, right? Feeling like we're constantly in survival mode can lead to a number of health conditions. In fact, we know from the ACEs study that trauma is the #1 public health crisis. It is the #1 predictor of health disparities and health issues. We know that people with repeated trauma will experience early death and other health risk behaviors. So this is an imperative thing to think about, and this is why, as it leads to a sense of chronic stress. So I'm going to pull down my screen and take a little break here and see, is there any questions about the brain component of this or the chronic stress piece of this? Because we're going to take this concept and apply it to what we're all experiencing right now with the COVID-19 pandemic. All right, well, I will turn it back over to Jen to talk a little bit about, and then we'll finish it up and do an exercise and have another opportunity for discussion.
Okay, so speaking of chronic stress, let's talk about life right now within the COVID-19 pandemic. So I can't see my chat box, but I am wondering, Nichole will monitor, but what are you noticing about mental health symptoms, about physical symptoms in yourself, but also your loved ones? Maybe you work with clients. What are you noticing as the biggest impact?
Inability to focus. Sleeping is hard. Deployment mode. Yes.
Yes.
Can you talk about, I think we have a mixed group here. So can we talk a little bit about what deployment mode means?
Is it okay if I unmute?
Absolutely.
Deployment mode at my house currently looks, my husband's active duty. Even though he is on shore duty and not actually deployed, he is like hyper focused on whatever is in front of him and then can't release that once he comes home. Like it's the constant, it just feels like things are coming at him from all sides. So he's just continually in work mode. And for me, that means that I am in like the spouse role of deployment mode of doing all the other things. We have 2 kids, so I'm doing kids and school for them and a job and, you know, making sure that everybody's where they're supposed to be when they need to be there. And we've become more like 2 ships in the night than people working together because the stress of the pandemic has put, you know, large stressors on both of us.
Absolutely. As an active duty spouse myself, my husband's active Army, we've had the same experience where that constant preparedness that you see right before deployment is constant now, right? It's that hypervigilance. And that an inability to focus and sleeping is hard that people mention are actually really big symptoms of trauma. This is what we see happen when people experience trauma. Someone else mentioned, my sons are too fast to emotion, tears are quick, my anxiety is high, night sweats and nightmares. Absolutely.
Yeah, definitely.
Jen, you need to share your screen.
Oh, I'm not shared? Not anymore. Let's do it. Better?
Yep.
Okay.
Anybody else have things that they're noticing?
So a global pandemic is going to have a sort of impact on every individual. So everybody is going to have some type of experience, but certain people are more prone to having severe trauma-like symptoms. And how you respond to stress during COVID can depend on your background, your trauma background, your current support system, your prior support system, financial situation, your health, emotional background, and the community that you currently live on. Our pandemic is considered collective trauma. So that is when trauma reaches a level where it negatively impacts entire societies or groups of people. So that's us, that's the world. Situations that may lead to collective trauma, besides the pandemics, also war, mass violence, genocide. Specific examples can be the Great Depression, psychological effects of World War II, 9/11 again, and the Great Recession. So when dealing with a pandemic like COVID-19, a lot of the world's focus, besides politics, is on the prevention and treatment of the disease, the immediate effects. But it's also important to consider that there are going to be longer term collective traumatic symptoms of the pandemic. Some of the potential long-lasting effects that it's going to have on future generations are increased individual and collective fear, damaged national pride, feelings of humiliation, increased feelings of vulnerability, heightened vigilance for new threats or new diseases. So what is it going to be like in the future when something else comes out? How are we going to handle that to make sure we do better? Okay, so we're noticing in our clinic what is most impactful on mental health right now. So we're seeing public health messages and media commentary being very triggering for people. This is especially triggering for people who already experience obsessions or intrusive negative thoughts. And research again on 9/11 found that people who reported watching more TV coverage of the attack experienced greater negative psychological effects. People who watched or listened to news coverage of the attacks for 4 or more hours a day were 4 times more likely to develop PTSD. And I know myself right now, I have to limit my exposure to media because even if I'm logging on to go onto social media and not focus on the pandemic, something's going to come up and I'm going to have to focus on the pandemic. There's unknown and predictability that leads to increase in trauma symptoms. So flashbacks might be more frequent and they might be stronger. So this all relates to that feeling of having control, not knowing what's going to happen next, not knowing if jobs are secure, not knowing what to do or what not to do in order to stay safe, lack of information that even scientists have right now regarding the future of the virus. And these are all things that limit our control of what we can do, which is going to intensify our trauma symptoms. There's increased risk of relapse if there's substance use and increased risk of self-harm. So primary coping skills taught in therapy to negate those things are usually, distraction, channel energy into productivity, relaxation, but then we're told to stay inside and then we're bombarded with media and tension. So it's hard to relax. And we're also alone with our thoughts longer and we're alone with our urges. And then of course, social distancing and quarantining, not being able to access one's usual support network, not having that face-to-face interaction, having too much face-to-face interaction with maybe the family that you've been quarantined with. There's increased stressors, there might be increased tension, and sometimes home life is not the safest place for certain clients. So what can we do? How do we cope when there's so much out of our control, when we don't know what's going to happen next? So if you lose your routine, fall back to your basics. And when I say basics, I mean basics, basic needs, eating, sleeping, moving, whether you're moving inside or outside, making sure you're hydrated. Holding yourself to the productivity standards that we had pre-COVID can be really defeating and debilitating right now. Try to do something nice for yourself every day. Celebrate small wins, no matter how small, no matter how simple it is. Lately, my win is if I make my bed in the morning, then I feel like I'm really adulting in the world. Like I have my stuff together on those days. Make sure you're maintaining connections. So being forced to be on our own is really damaging, and connection with people is so crucial to mental health. So being able to connect with people online and on the phone is helpful, but for some it can be really overwhelming and confusing, probably uncomfortable. So it takes time to figure out what's going to work in place of that in-person interaction. So try to help those that struggle with technology. Check on your single or no family member neighbors in your community. An approach is also to reflect on past coping. So remind yourself of your resilience and reflect on how you've coped in the past. If you've experienced trauma, significant negative life events, or mental health challenges, then there's likely a time in the past where you were more isolated, withdrawn, or challenged. So you might have to look back and be surprised of what you've been able to cope with and get through. it's time to reflect on those times and use that learning as your strength. So you might have to come up with a plan, a routine, a hobby, a coping kit that we like to build with kids and teens here, that you know is going to help when things get hard. And then of course, I'll keep saying it, limit your exposure to the news. Not saying stay uninformed, but know your personal signs when you're hitting your limit, when you need to tune out, switch off, and get off of the social media news. Try to stay in the here and now. Be present. Many of us have things in our past that affect the way that we live now. Many of us also worry about how things are about to pan out, and both are very important. But in terms of how we're doing right now, while coronavirus restrictions are in place, it's going to be helpful to try and live mostly in the present, taking it day by day, respecting the past, what it means to you, being hopeful for the future, but focusing on now. And of course, seek the support. If you become mindful of what are the signs that you might need some support with your mental health, make sure you reach out and ask for it. So what can we do? How do we approach those that are struggling with trauma? So first, I'm going to go into trauma-informed care versus trauma-specific care. So trauma-informed care is not trauma-specific treatment. So trauma-informed care requires that shift from asking what's wrong with this person to what has happened to this person. What has this person been through? How did they get here? So trauma-informed care is what the client is going to receive from the entire staff in the atmosphere of an agency or our clinic. So we're a part of two different organizations that both honor and ensure trauma-informed care. So everyone from our admin staff to IT to the clinicians are trained in trauma-informed care. Now, trauma. Go ahead.
I was gonna say, I think it's important to consider that we all can be trauma-informed. You know, that at the end of the day, trauma-informed care is saying, not looking at somebody like it says and ask what's wrong with them, but consider and assume that this person has experienced trauma in their life. You know, most of us have. And so how can we be a little kinder, a little more understanding, a little more empathetic in every action that we have with another human being, another organization, another entity that might be considered of the fact that, you know, we're all struggling with something. You know, at this point, we know we've all experienced trauma because we're all experiencing a pandemic. You know, and so how can we keep that in mind when we talk to people?
Mm-hmm. So trauma-specific care is going to be limited to trauma processing that's done within individual therapy between the clinician and client. Disclosure of trauma is necessary for trauma-specific treatment, but disclosure of trauma is not necessary for implementing trauma-informed care. So trauma-informed care is going to assume that all individuals have the history of trauma, recognizing trauma symptoms, and acknowledges the impact that a person's past has. So this type of approach fosters an alliance between provider and client to work together to build that sense of control and that sense of empowerment. I think I skipped one. Yeah. So trauma-informed care practices and principles, just going to run through this. So we have safety, choice, collaboration, trustworthiness, and empowerment. So safety is going to mean both physical and emotional safety, feeling comfortable, feeling welcomed, making sure that the client is walking into an environment that they're probably going to want to come back to. So for example, in our clinic, we have in our front waiting area, we have our general waiting area, and then we have what we call the quiet waiting area. So that's a separate room off to the side where you would be less exposed to having to be around other people. Maybe if there's kids in the play section running around, you won't be as activated when having to sit with excess noise. And then we have choice. So emphasizing client control is what choice does. So people want choices and options. And for people who have had control taken away from them, this is a big deal. So the more choices that an individual has, the more that they're likely to participate in services. Collaborating, of course, is not just collaborating therapist and client, but collaborating as a clinic team in order to make sure that clients are getting the care that they deserve. Trustworthiness is establishing and maintaining boundaries, making expectations clear, and that fosters reliability and emotional safety, so they know what to expect. And then of course, empowerment. Empowerment is something that's been highlighted throughout the presentation. So focusing on the individual strengths and empowering them to build on those strengths, reminding them that they already have foundational strengths and it's just making them stronger. Building skills for when they are no longer in therapy is part of this empowerment so that they feel like they can implement them on their own time. Okay, so getting into trauma-specific treatment. So trauma-specific treatment, they're evidence-based treatment models. They've been proven to facilitate recovery from trauma. They directly address the impact of trauma, and they are designed to treat the actual consequences of trauma. All of the models should emphasize empowerment of the survivor and creating the feeling of safety. So it highlights what most of the commonalities or what the commonalities are among trauma-specific treatments, but I want to just highlight two especially. That would be exposure and cognitive restructuring, or the tough stuff. So this is the mud crawl, these two things. So the exposure piece with the trauma processing models helps people face and control their fears by exposing them to the trauma memory they experience, but in a controlled and safe environment. So exposure can include use of mental imagery, writing, or listening to their own narratives of their story. Cognitive restructuring, so that's what helps make sense of the bad memories. So it's common for people to feel guilt and shame about aspects of their trauma that were not actually their fault. So cognitive restructuring helps people look at what happened with fact in order to get realistic perspective on the trauma. And this just helps align both logical and emotional understanding of the experience. So everyone can be trauma informed, but the ability to provide trauma-specific treatment requires additional specialized training. And here at our clinic, we do offer several evidence-based trauma therapies, including prolonged exposure therapy, cognitive processing therapy, and EMDR. So I have some foundational work that can be done within trauma therapy. So enrolling in trauma therapy doesn't mean that you have to jump into trauma processing tomorrow. There's other foundational work that can be done to support trauma recovery. That includes psychoeducation, so teaching the individual about their symptoms, how to recognize it, anticipate them, what they mean, and how to manage them. This helps decrease shame, confusion, and helps relieve that sense of feeling defective or broken. We want to teach the client about trauma and PTSD in ways that celebrate and emphasize that if they had the ability as a small child to survive this horrific thing, then they have all the resources they need to recover from that symptom now. We want to convey that all of these symptoms make perfect sense as a response to trauma. Other things are mindfulness and grounding. So these abilities to help strengthen the mind-body connection that's often compromised by trauma. Grounding and mindfulness addresses dissociations, avoidance, numbing tendencies, being able to be present as necessary in trauma processing to prevent that risk of re-traumatization. Of course, having safety plans, crisis plans in place to make sure you're managing acute risk issues. So making sure you emphasize the client's ability to self-rescue and manage their own thoughts and impulses, and then having a backup plan to that for more professional resources. And then we have calming the mind and body, so relaxation techniques. So yes, traumatic experiences get locked into the brain, but they also get locked into the muscle memory of the body. You can feel fear in your gut, you can feel panic in your chest. Managing these body-based symptoms are going to reduce the emotional response that result from them. Common exercises are square breathing, belly breathing, progressive relaxation, and Nichole's going to lead us in one of those in a little bit. So how do you know that someone is ready, or how do you know that you're ready for trauma processing? So of course, the person needs to feel that they possess the resilience and emotional reserves to face that experience, because it will take the person back to that scene. The person will feel like a scared kid in front of a violent dad, or like a defenseless girl in the hands of a rapist. As you can imagine, the client needs to feel able and prepared to confront these ghosts. Trauma processing will make the memories stay in the brain as only memories without the intense emotional negative effect that they had before. They won't feel like they're reliving this memory in their day-to-day life, and that's only part of what trauma therapy is. Then comes the reconstruction of self, the rewriting of the narrative, and planning how their newfound relief might improve their future. Everyone that suffered from trauma is ready to start therapy. That's why they're here. But to feel ready to process trauma and trauma-specific treatment, that can take some time. I'm gonna hand it over to Nichole for a quick relaxation exercise.
Yeah, so I'm going to teach you all a quick exercise that this is my starter exercise for pretty much everybody I work with in practice, but especially people who've experienced trauma. And to make this connection back to the brain, that once we do this exercise, once we get good at this exercise, what happens is we're able to use this to get our brain back online. So when we're feeling flooded and overwhelmed, this exercise will help us get back to the place where we're more intentional, we're more thoughtful, and we're able to engage in life the way that we want to. And so I'll give some kind of education, the different steps, we'll put it all together, and then we'll have some time to take this all down and turn off the recording and just discuss anything else that's lingering, any other lingering questions you have. So I want you all to just get comfortable wherever you're sitting and just take a minute to check in with your head and just make a note of how you're feeling. What's going on in there? How you doing in this moment? And the first part I'm going to teach you is breathing. So I'm going to have you put a hand on your chest and a hand on your belly and just take a deep breath. And which hand rose? The one on your chest or the one on your belly? Chest. A lot of people will often say their chest. Yep. So when we go back to our systems we were talking about with your brain, your chest is like your gas. Breathing through your chest ultimately looks like that, and that's like the gas. So that turns on the system in your body, and is part of the system in your body that makes you feel stressed and anxious. It's part of your fight or flight system. Our first goal is to try to take a deep breath and think about filling your belly. And it's not easy. We are so used to kind of sucking in and doing all of these things and doing this chest breathing. But if you watch a baby breathe, if you have children, they breathe through their bellies because that's where we're naturally supposed to breathe. So take another deep breath and try to fill your belly like a balloon. Breathe out. And try one more time. And what happens when we breathe through our belly, once we're able to do that, is that you have a nerve that goes through your system that will actually turn on the brakes, right? If breathing through your chest is the gas, breathing through your belly is the brakes. Your two systems, they're called your parasympathetic and sympathetic nervous system. They cannot be on at the same time. You can't be stressed and relaxed. Your body just doesn't function that way. Those systems would get crossed and it would just be a mess. So if you're able to breathe through your belly, we're one step closer to turning on our relaxation system. So we'll try it one more time. Try to get one big belly breath. Breathe in, long exhale. So that's part one. The second part I'm going to help you find is what is often called your one spot. So if you want to think about the muscles, all of the muscles 2 inches below your belly button. So if you think about your hip bones connecting across the front, down to your sit bones of your butt, across and back up again. So everything 2 inches below your belly button. And I want you to think about letting those muscles go soft. So no sucking in. Let your belly button fall back to your spine. Relax your pelvic floor, your Kegel muscles, your glutes, thighs. Nobody can see you if you have bad posture right now. Just let everything go soft. And again, sometimes this can be really tough because we're used to not sitting in this way or not being in this way. We're used to a lot of tension in that area. And what we find is if we can let this area go soft, it can trigger relaxation in the rest of your muscles in your body. And so I don't want you to be discouraged if you can't do it the first time. I taught this a lot before I actually was able to get myself to do it because I hold a lot of tension in my own body. So I want you to put it all together now. So we're going to get comfortable. You can close your eyes or have them open. Take a deep breath in. Long exhale out. And relax all of those muscles 2 inches below your belly button. Relax your core. Let your belly button fall back into your spine. Relax your glutes, your thighs. And take another deep belly breath in. Have a long exhale. And think about relaxing all of those muscles again. Relax your core, your thighs, your glutes. Just let them all go soft, no clenching, no tightening. And take one more deep breath in, fill your belly like a balloon. Exhale. And again, relax all of those muscles. Let everything go soft. And when you feel ready, I want you to check back in with your head and just notice what's going on. If anything's changed, not changed. And when you feel ready, if you could share in the chat or unmute yourself and share out loud, what did you notice from the start to the finish? Less noise. Yeah, people will often notice less kind of less noise, I think, in the thinking in their head. Sometimes will also feel a little fuzzy. A lot of times people will notice feeling sleepy because we associate relaxation with sleepy a lot of times. Sometimes this can be really hard for people at first. And so again, I don't want anybody to be discouraged if it didn't feel comfortable, you weren't able to do it the first time. But what we find is the combination of these two things, the deep breathing and relaxing that part of your body, that you are the first step of being able to take control back of your body. This will help you be mindful in the moment and help you learn self-rescue skills, right? Self-regulation skills to help quiet some of the chaos that's going on in our brain, especially related to trauma. But this is an exercise, as I mentioned at the beginning, I teach with everybody I work with. So not just people who work with trauma, I teach it to transitioning service members, getting out of the military. I teach it to children. I will lay down on the floor and teach kids belly breathing because it's really easy to see your belly rise and fall from the floor. You know, that this is a good starting place to be able to get to a place where you feel more intentional in your actions. I encourage people to practice this when they're first starting out 10 times a day. And 10 times really is one breath. So 10 breaths worth of practice can make it to where this becomes automatic, that when you are feeling stressed, this will become a more automatic response for you versus whatever the current coping is with stress. And when dealing with all of the stressors that were going on a day-to-day basis, you know, this is a perfect place to start with taking control back over that. Any questions? So go to the next slide that will share our contact information. Here is where we are located specifically. We serve post 9/11 veterans and their families, regardless of discharge status. We also serve families as defined by the veteran. So we have a wide range of people that we are serving. We are currently providing our services via telehealth to keep everybody safe, obviously, in this pandemic. There is our address, also our phone number to reach out if you're interested in contacting with us, our email, our website, our social media contacts, and also the information for both Jen and myself. I also, before we turn off the recording and open up to some more questions, we have another seminar on August 6th. We will share the Eventbrite link in the chat. This one focuses on couples, families, and children and some of the specific challenges that we see military families, couples, and kids facing, you know, on a regular routine basis, but also within our current situation. And so you are more than welcome to attend that one. It'll be on August 6th, and all the information is on the Eventbrite link. And if Chris, we can stop recording and we